Hello beautiful people, it's Dr. Ahmed. We're back again with another video. Today we're going to be talking about the non-surgical rhinoplasty for a patient that's already had surgical rhinoplasty. So, when you look in the mirror now, what are the things that kind of catch your attention, positive or negative?
I do love the results from my surgical rhinoplasty, but I have noticed that the tip of my nose, especially when I'm smiling, I feel like it's pulling down. It creates a V, and that's making me very self-conscious. And I think it's because I've had it tucked in at the sides
To make it smaller or slimmer?
Yes, yeah. And it just feels it still looks quite bulbousy and big there on the end. That's what I see every time I look in the mirror.
And is that something that affects your self-confidence and so on?
Yes, I think especially because I've always had a thing about my nose, which led me to have the rhinoplasty, but it's just a different issue now. So it's always the first thing that I look at when I look at myself in the mirror. And to me, it's very prominent.
I see. I mean, obviously, from my perspective, you look absolutely gorgeous. I don't think there's anything that sticks out. Yeah. But I think people have really personal relationship with their nose. The nose is one of those areas where people really notice it in the mirror, because it's obviously the center of your face, isn't it?
It is, yeah. You can't hide from it.
It's right there.
It's there, yeah.
And especially after surgery, because it's a bit difficult sometimes to predict exactly how things will look, especially with the fact that you get a lot of swelling, sometimes scar tissue. So the results might be slightly different to what you expect. So I actually see a lot of patients these days coming in for derma fillers because they're not mega happy with the results of their surgery. Yeah,
I think that's it. And there's nothing more that can be done surgically, so it's just trying to see what I can do.
You don't want to go under again
No.
Exactly.
So if I've had surgery before, does that change what kind of non-surgical rhinoplasty I can have?
Yeah, so actually it means that things are a little bit more advanced today, simply because post-surgery your anatomy changes. So where the blood vessels are normally might be a little bit different, which makes things a little bit more risky. And this is why you need to come to a doctor that specializes in these things.
Okay.
So we're going to be taking our time. We're going to be really marking the nose carefully to make sure we're away from any blood vessels, and we're going to be aspirating before we inject. Do you know what that means?
No.
So essentially, if this is your skin and then when the needle goes in, we don't inject immediately. We actually pull the plunger back to make sure that the tip of our needle is not in a blood vessel. Because if it is, I can see the bubbles of blood going into the needle. If that's the case, we'll pull back, apply some pressure, and we're good to go. If after 15 seconds there's no blood, it's safe to inject.
Okay.
As a part of our consultation, we had a little chat about the chin as well. Because actually a lot of patients, when they come in, they don't realize the relationship between the nose and the chin. It's basically your profile lines. So you always think about the chin when you think of the nose, because by bringing the chin out 1 or 2 millimeters, it makes the nose look a little bit more small and petite. And I think with you actually, by just doing a touch of derma fillers in the chin, I think we'll just balance everything out. It's called a profiloplasty.
That's interesting, because when I look in the mirror, I just look at the nose. I don't see anything else.
It's all about the illusion, isn't it? Actually, by kind of changing things up a little bit, it just takes your focus away from one area to another, and it just makes it a bit more balanced.
Which makes sense, because when I look at anyone else, I don't look at just one area. It's the whole thing, isn't it?
We're our worst critic, aren't we?
Yeah, I just zone in on the bits that I don't like.
Exactly. So now we're going to be assessing really the anatomy of the nose. So I can see a slight dip there, which we can soften by injecting through. There's a slight little dip right there. And then this is the tip. The tip is a little bit heavy, particularly when she smiles. So what we're going to be doing is injecting just above the tip to basically recreate a new tip above. So when the light hits it, it reflects up rather than down. And we're going to be injecting underneath. And the purpose of that is to essentially camouflage that actually her nose kind of points that way. So just smile for me for a second. You can see how the tip goes downwards. Whereas the way that we're going to inject it, we're just going to lift it up a little bit. So it's all about the illusion that actually it reflects light up, not down. So we're all done with the treatments. Let's have a little look. big reveal.
Oh wow! How's that worked?
So what do you see? Tell me.
It just looks, it feels a lot small. It doesn't look as big. And it doesn't move the same, it doesn't draw down.
When you smile now,
yeah,
it projects up rather than down.
Wow. I never expected that.
Try and not touch it too much yet, just because obviously the injection marks are still there.
Yes,
so
yeah.
next 24 hours, try and just leave it as it is.
It just feels a lot more in proportion, everything.
It's the chin, you know, because that really brings everything in balance.
Yeah.
Because when people talk about their profile, it's usually the line between the chin, the bottom lip, and the nose. Right, so yours was a little bit more forward because the nose was projecting out and the chin was a bit in. So now we kind of moved it back into center, so everything is proportionate.
Yeah. I never even would have thought anything with to do with it.
Yeah. I guess this is why people come in here, right?
Oh wow, I am so pleased, thank you.
Look amazing.
That has just made such a world of difference, hasn't it? Yeah.
Have a look in the big mirror, you really see it in the big mirror. And even now when the light hits at the reflection, it reflects the top of the tip rather than underneath. Because before when you smile, I see the reflection of light here, which means that the tip is going downwards. Whereas now, look at the reflection of light. It's right at the top, so it's up.
It's going, is that because you put it?
Exactly.
Stuff it right.
It's all about the illusion. It's giving the illusion of lifted.
It feels counterproductive putting things into a big nose. So like,
everyone says that.
I want it out.
They're like, well, it's smaller. But actually, we've shortened the bridge, so now it just looks more up. So Helen, do you have any questions for me?
Is there anything I shouldn't do immediately after?
Yeah, so next 24 hours, try and take it easy. So no alcohol, no gym, no sauna, nothing that basically increases your chances of developing infections like touching the area or anything like that. Okay. No skincare tonight, so resume kind of skincare from tomorrow morning. Avoid any retinoids or anything too harsh for the next 24 hours as well. Okay, and will it swell any or? It's a really good question actually. The nose area can swell a little bit. So if you wake up tomorrow and it kind of looks like it's old nose, a bit more bulbous, a bit bigger, that's nothing to worry about. It's expected and it will subside within the next 7 to 10 days. You might get a bit of bruising, particularly in the tip. Again, nothing to worry about. But because the nose is a higher risk area, if you're ever worried about anything, message me or message whoever you're going to for treatment, because actually you might need a little review quickly. Okay. Perfect, thank you. No worries at all. That's a wrap, guys. If you've enjoyed today's video, please give us a thumbs up, subscribe, and follow all my other social media channels.